Okay, thank you, ladies and gentlemen. So now we move on to birth control. Actually, we'll end up talking about lactation as one of the birth control methods. Because, let down of milk, especially at the beginning, that's why the mom doesn't fall pregnant immediately, after they give birth.
I thought that wasn't really something you should rely on.
You can't, and we'll talk about it.
Okay.
Yeah, we'll talk about why. You can't, nobody relies on it, of course.
No.
Women will give birth every year if they're not careful.
I have a friend that has kids that are the same age for a year because she thought that. Like
Yeah,
3
it
months
happens.
out of the year, they're the same age.
Yeah. So what is birth control? It's the voluntary control of how many kids you have and when you have them. So you gotta have, that's birth control, all right. Okay, and we'll talk about the different methods. So what it is deciding how many kids you want to have and when you want to have them. So you gotta have those two components if you're describing birth control. Okay. Because I'll give you half a point if you just say, if you just say one of those things. So it requires contraception, which contra is against conception. Okay, and conception is fertilization, is coming together. Okay, so you can stop it one of two ways. You can either, prevent the fertilization altogether. You know what I'm saying? Prevent the sperm from getting with the egg to fertilize it. Or you can prevent the implantation, which has got issues. Because, and it depends on how you feel about it. That second pathway, we prevent the blastocyst from implanting. What does it mean? It means the egg has been fertilized and that a human is already starting to develop. Do you see what I'm saying? So it depends which kind of, depending on your beliefs and whatever, which methods you choose. Okay, you know what I'm saying? So things like the intrauterine device and so forth, they prevent the blastocyst from implanting, which means the fertilization does occur and the embryo will start to develop. Except that it won't implant, and then when
Doctors don't tell you that though.
Yeah, they don't. Now I am, because this is physiology. That's how it works. See what I'm saying? So now you can make an informed decision when you choose your birth control method. You know what I'm saying? Okay. So I just want you to note that those are two methods of contraception, not to be confused with birth control. Okay, they're two different things. See what I'm saying? Because in the exam I talk about birth control, and then they're talking about how you prevent the blastocyst. I'm like, no, that's contraception. So you get it? So, because I'm going to do that differently, I usually ask about that. So these are the different methods of birth control. Some of you have seen them, some of these already. Some of you use them right now, okay? Well, not some, all of you, because, well, I'm thinking Ken was here, but Ken is not either. But Ken too uses some of them, because Ken can use that over vasectomy. You could use that, okay? So it's for both guys. For both sexes, and this is the cervical cap, the diaphragm, and this is the latest shape of the intrauterine device, IUD. And the way it works is that it's got this copper in it. You see this brown part is copper, metal. It will destabilize the uterus.
I don't think they use those anymore. They use the ones that are hormone filled now. Do they use the copper ones?
I don't know.
They still use that.
some
They
of them.
just don't use it as much as they used to.
Yes, they use the other ones, yeah,
The
that's food
marina.
hormones and stuff like that. But we'll talk about some of the disadvantages from that, okay? And that's the common monthly pill, and of course tubal ligation for the female, vasectomy for the males, okay? And then of course femicides and spermicidal hormones, which have a high failure rate. So here I'm going to list all the kinds of birth control methods, okay? Birth control methods. Another thing is, if I ask about birth control, people give me an example of a birth control method. You see what I'm saying? Don't do that.
What? If you repeat that?
If I ask about birth control, and people can sometimes tell me about contraception, or they tell me an example, they give me an example of birth control. I'm like, no, that's an example of birth control. Define birth control. What is it? That's when you talk about when, and if, or when, or how many kids you will have. That's birth control. But these are the methods of birth control, methods that you use to practice birth control. So coitus interruptus, like the name says, it interrupts sex. That involves the male pulling out just before ejaculation. Okay, and we talk about some of the disadvantages there. Rhythm method, it's just the natural family planning. Sometimes it's called. That's what back in the day they used to use. And then back in the day, how many kids did they have? Like a million, like a zillion babies, because they rely on the lactation that I was talking about earlier on, and things like that too for birth control. So they continue to have sex and do their thing and carrying on like that. without using any kind of birth control, except that, you know, if you have sex at some of the infertile times, the female doesn't get pregnant. And I guess they try to avoid naturally when the female is fertile, like around ovulation day, which is when the female looks more attractive actually because of the estrogen. And so it's harder to abstain at the time when the female is really looking, you know, and your libido goes up too, because it's a survival thing, right? It doesn't make sense that when your egg is releasing and then your sex drive goes down. No, it goes up. Okay, so mechanical methods, you know about them: cervical cap, condom, male and female, and then chemical barriers like spermicidal forms, that kill. And then combined hormone contraceptive is the common pill that usually taken orally. Sometimes it's given 4 ways, and we'll talk about it. But then the injectable contraceptive is like a Depo-Provera. It's another chemical that is used. It's hormonal, okay, but it's injected, and every 3 months it works every 3 months. We'll talk about the disadvantages of that. Intrauterine device, IUD, and then of course surgical method, which includes vasectomy and tubal ligation. Okay, so we'll go about through each of those. So, coitus interruptus, withdrawal of the penis from the vagina before ejaculation, okay, thereby preventing the sperm cells from getting into the female, supposedly. Okay? Because what happens? Sometimes, you know, the pre-ejaculate, you know, the mucus that comes out to lubricate the penis and the vagina, may have some sperm cells in it because there is the vas deferens, remember? It's about 45 centimeters long. So she may have already been pregnant and you pull out for nothing. You know what I'm saying? So that's one of the things. So besides, for the male, it's difficult to pull out because that's the most pleasurable part, and you're asking him to stop. It doesn't make sense. So males kind of fail to do it. They'll probably release a few and then it will come out, you know. Because the male only gets it one time, whereas the female gets multiple orgasms, so they don't mind which one it is. They stop. Some of them do. Not all of them get multiple, okay? But for the male, it's the only one time that they become osmotic. So for the male to pull out, it's very difficult. It makes sense? And I said already the female. So sometimes I ask you to describe the birth control methods and the disadvantages and advantages. Okay. No, the advantages are obvious. It works. But the disadvantages is what I want you to list usually, because that's the content. Coitus interruptus. Okay, the next one is the reading method. Sometimes it's called timed coitus because you time your sex. Coitus is sex, by the way. You know what I'm saying? If you say, if you want to be fancy, say, well, we're just having coitus. Can you wait a little bit? You know? And then they'll think maybe you're doing some ritual, some religious thing. They won't know what you're talking about. So you can use it. Say, oh, we're doing coitus right now. And then they'll think you're doing some sort of Jewish thing or something. You know, you know, it's like a code word with your husband because that is your, or whatever, your partner, whatever it is, I don't care. Okay, so it's also called time coitus because you time your sex and you have it when it's not, the female is not fertile, you know, which is most days prior to ovulation, you know, and 1 day, 2 days after. So what does it require? This method, it requires abstinence 2 days prior and 1 day after ovulation. But remember I told you that sperm can last 5 days in there, you know. So then the disadvantages start to come about in terms of determining the period when the female is not fertile. You know what I'm saying? That becomes hard. So that becomes the disadvantage of that. That's why people back in the day had like 10 babies. Most of them, you know, like most of my parents, each of them, they had 10 kids, 9 kids. That's what they used to do because they relied mostly on the timed coitus. So, like I said, it's difficult to identify the times when the female is not fertile. It's very difficult because these 2 days may not be enough actually if you abstain 2 days before ovulation because the sperm can survive more than at least 72 hours. I would put it more, maybe 6 days before. But then it will restrict spontaneity, which is what the fun part of sex is. You can have it whenever you feel like it. When you're feeling it, then you do it. But with this method, you can just do it any time. You have to say, oh, you have to have a timetable, literally. And that kind of kills it already. Okay?
So a tribe of kids kills it too.
Yeah, of course. You'll be like, oh, we can't. You know, I don't know why the female cannot have sex when the kids are out there, you know. But most females don't like to do that. So difficult to abstain around the ovulation time. Why? Because the female is looking really good at that time because of estrogens. Okay, it's a survival thing. When the female is ovulating, they look more appealing and whatnot. Their skin looks good because of estrogen and whatnot. Okay, and then they become more. They probably wear inadvertently sexier things or something, and so it's difficult to do. So these are the disadvantages. And this is what you do. Most of the time, I want you to be able to describe the method, what it involves, and the disadvantages. Okay, I usually ask about that. Okay, then mechanical barriers, you know what it is, it prevents entry of sperm cells into the female reproductive tract. So you could use a cervical cap, a diaphragm, a condom, which you can, male and female, you could do that. You know, the diaphragm, the only big thing about it is that it has to be inserted by a physician. So not many people are going to the doctor just to get the thing inserted, because it has to be fitted. Okay? So that's another down. So with it, other than that, there's not really much disadvantage to these mechanical barriers. Okay. Besides, mechanical barriers also prevent STDs. At least the condom does. Cervical cap doesn't, because you know the female will still get that. You know what I'm saying? And the male will still get it. They're not using condom. So chemical barriers would be like creams, foams that the female will apply into the vagina, and then they will have spermicidal properties, which means they can kill sperm. Okay, but they're easy to use, but high failure rate. The very nature of sex will displace all these forms. You know what I'm saying? You know, and some sperms will get up there. Okay, so high failure rate because of that. But they're more effective, of course, if you use it with a condom. In fact, they're designed to be used with the condoms, but if you break one of those times, it increases the effectiveness of condoms. If you use them alone, good luck. Okay? So you need to have it in conjunction with condoms and spermicidals. Forms. You remember I was talking to you? Yeah, no, you shouldn't rely on it because it's got disadvantages. But lactation is a form of birth control because when the child is suckling, it will stop the release of the gonadotropins, like luteinizing hormone. Remember what luteinizing hormone does? It causes ovulation. FSH causes the follicle to develop. So if you get no follicle developing, you're getting no ovulation, then you get no egg, no fertilization. So you could have sex and you might not get pregnant. So suckling action potentials inhibits gonadotropin releasing hormone so that LH and FSH are not secreted by the anterior pituitary, right? And then of course, but eventually the menstrual cycle will begin. Okay? So you'd have to be feeding, suckling, breastfeeding for this to work. If you're giving formula, it's not going to work, okay? Because the suckling is what stimulates that. See what I'm saying? So don't think, oh, lactation, so we can do it. But if you're not giving, breast milk, then no chance of that. Okay, because it's this that causes it. I'm not sure, but if you're doing that breast pump, because some female pump, it may have the same effect. I don't know how different it feels. I don't know. But yeah, it might create the same effect. But who knows? Menstrual cycle, and then disadvantage, of course, it's not very effective, like you were saying that, right? So that's the big thing. And it's only for a short time too, because eventually the menstrual cycle will resume. So, that's another form of birth control. And this is combined hormone contraceptive. This is the most common by far that's used by women, and usually you can take it, orally. So it delivers estrogen and progestin in combination. So that's why it's called combined hormone contraceptive. Okay. So estrogen, and this is like a synthetic progestin in combination to prevent pregnancy. And what does it do? How does it work? It disrupts FSH and LH again, secretion. And those are the gonadotropins that cause the follicle to develop. LH causes ovulation. So if you don't have those two guys, there's no follicle and there's no, you know what I'm saying? So methods of delivery, it can be delivered 4 ways. Okay? The most popular way, of course, is orally. You're taking the pill. Okay? So do not confuse injectable contraceptive with the monthly injection of the combined hormone contraceptives. Okay? The monthly injection is just a method to apply combined hormone contraceptives. Okay, so do not confuse that, because sometimes they ask you to define what are combined hormone contraceptives, how do they work, and then describe the 4 ways by which you can administer them, and then you get 5 points. Okay. Sometimes you put a small flexible chemical ring right there by the cervix into the vagina, and it will have the combined hormone contraceptives that are released, and then does the same thing. It's just a method, a different route of administering the same thing. Sometimes they have a patch that you put on here or somewhere, or you can put it on your butt or whatever, and then it's a transdermal, application. Okay. Some of the pharmaceuticals, when they do research on some of these drugs, it's kind of fun actually. Because I used to work in there, and then it will transdermally introduce through the skin estrogen and progestin, and then the same thing, get the same effect, and so it will be every month you have to put one. If you're taking those pills, you take them and then they last a month too, simply. But the only thing about it is that you have to be popping a pill every single day. So some females are now going to patches or whatever it is, monthly injection or whatever. Skirmish with needles, but that's the most common already. So how it works, what it is, disadvantages or methods of application. So for all these birth control methods, it's usually you tell me how it works and the and what it does, or what it is and how it works, and also the disadvantages. For this one, it doesn't really have much disadvantages. So we talk about the methods of delivery. There are four ways you can deliver the same thing. Once you disrupt the FSH and LH, there's no chance of fertilization because you don't have an egg. And then this one, like I was saying, is an intramuscular injection of depo-provera. Okay, it's so different from a monthly injection of the combined hormone contraceptives. You see what I'm saying? This one is effective for 3 months. So what is it? It's an intramuscular injection of depo-provera. Okay, and it's effective for 3 months. So you only get it every 3 months. Okay, it's kind of very effective, but it's got some big disadvantages. So prevents maturation and release of the secondary oocyte. The secondary oocyte, the one that's arrested in metaphase 2, that is not going to be released. So you're not going to get any fertilization, just like.
So it prevents ovulation.
Yeah, it prevents ovulation, just like the combined hormone contraceptives do the same thing. They prevent FSH and LH, so you're not ovulating too. Okay, so that you're not getting any fertilization whatsoever with this method. See what I'm saying? So that was the first method of contraception. So what about it? It makes the uterine less conducive to the embryo. You know what I'm saying? So if you are a female who wants to get pregnant later on, and the longer you use this, the more hostile the uterus becomes to the embryo. So while it's effective, it's got these things that go with it. So it works in 2 ways. Prevents the release of the secondary oocyte, and it makes the embryo hostile to implantation to the uterus. I mean, to the uterus is hostile to the embryo. What are the disadvantages? Big ones. It takes up to 18 months to become pregnant again, almost 2 years. You know what I'm saying? Trying to get pregnant again, because it really kind of works on the uterus so much, and to get out of it, so to reverse the effects is bad. It doesn't, and it also causes weight gain, which females really don't like. They're gaining enough weight from the estrogen, let alone that. So, be able to tell me the way it works, what it is. Like this one is an intramuscular injection of depo-provera. That's what it is, and then it disrupts the release of the secondary oocyte, and it makes the embryo hostile. I mean, the uterus hostile to the embryo. Okay, now the intrauterine device is what it is. It's a device that is inserted into the uterus. Okay, and it's placed in the uterine cavity. Okay, it's pretty much something that you just place an object inside the uterus, so that when the blastocyst comes, it won't implant. You see what I'm saying? It's just, and then there are going to be disadvantages with that. Okay, because if you place an object into an organ that periodically grows, it's going to grow into it. And it's going to damage the uterus. It interferes with blastocyst implantation so that it doesn't prevent fertilization. It's already fertilized, so it means you literally get pregnant every month. If you're having consistent sex, you are going to get pregnant. Every month you do get pregnant, but the blastocyst is not going to implant. That's what this method does. That's what it is. So if you are inclined to use it, that's fine, it's no problem. But just know that every month you are getting pregnant. But the thing is not implanting. So one of the disadvantages is going to come from that, from the fact that you do get pregnant every month if you are having consistent sex with a fertile male. Okay. So one of the things that it can be spontaneously comes out. Of course, I mean, if you put a foreign object inside of you, it's going to come out one of these days. Because the uterus can try to contract to take it out, because it's a foreign object. See what I'm saying? So that happens. I don't know how often, but it does happen. It can happen. Okay? And then, of course, it will cause, it's kind of obvious, it's going to cause abdominal cramps, very bad periods, because you can bleed a lot. Because imagine this uterus is growing into this foreign object inserted inside of it, and then when it sheds, it's going to shed a little bit more. So you have more heavy bleeding. Okay? So that's can't be good. Of course, it's going to damage the uterus, because it's going to be growing into it every month and going out of it, going in, going out. No good. Okay? So it does that. This is another one. Remember, you get pregnant every month. So sometimes it doesn't prevent this blastocyst from implanting, and it does implant. And the kids have been born attached to the ovaries. Yeah. I don't know where.
That it actually went through her uterus and got stuck to her spine. Yeah.
That kind of gives me the creeps, even though I don't get anything inserted inside of me. But so these are the disadvantages of IUDs, okay? And that's all it does is prevent blastocyst that's already been fertilized from implanting. Okay? So gotta know the disadvantages, gotta know the method, what it is, and how it works for each of these birth control methods. And of course, sterilization of the male and female is most reliable in terms of vasectomy and tubal ligation for the females. So this is the most reliable, it's 100% effective, but only if you wait, With the male, it takes about 2 weeks, to heal, for starters, but it will take several weeks later for all the sperm to come out of the male reproductive tract. Remember, the vas deferens is 45 centimeters on one side, 45 centimeters, and there will be sperms in there. Okay? 45 centimeters plus 45 centimeters is almost a meter long of sperm cells. So you gotta let them come out. It's gonna take like a month or so. So it takes about so you during that time you are using condom until you go to the doctor periodically to get checked to see if your sperm count is now zero. You know what I'm saying? So for several weeks. Females tubal ligation, the fallopian tubes, the oviduct, or the uterine tubes are cut and ligated and kind of tied up. And this procedure is done by 2 doctors. One is an anatomist who will actually identify and say this is positively the fallopian tube, because you don't want to tie any old thing, like connective tissue in there, and then go. You know what I'm saying? Because then that will start, the female will be getting pregnant, meanwhile something else is getting messed up. You know what I'm saying? Yeah. So the surgeon does the cutting and the surgery and the ligation, but there's a first doctor who comes in and says, okay, this is it. Okay, so that's tubal ligation. So the other methods really change hormonal concentration. They don't affect sex drive. You can still have sex as normal, but that's about it. It can be reversed by a microsurgery, but the chances of success after it for a very long time are slim. Okay? Sometimes they may not be able to reverse it because it's scar tissue when you do that. Okay, when you cut anything and then it heals scar tissue, to try and reattach it. Again, when it heals, it may form scar tissue and it's too block tubes or whatever. Okay? So don't count on it working really too much, but it does. It can be reversed. And then there's a, what do you call it? So they cut it right close to the epididymis. Okay? So they'll take out the spermatic cord, and it's got those connective tissues. It's got the cremaster muscle, it's got the blood vessels, and then it's got the vas deferens in it. So you really have to go in there and search out the vas deferens and cut that, and then ligate that one. Alright? And then of course there is the tubal ligation for the female and vasectomy for the males. Okay. and then I'm going to show this is all these methods just one by one. And these are, some of them are the old school ones. There's a condom right there, male condom, and diaphragm, and spermicidal gel, spermicidal with the applicator. And then this is the common peel. I mean, I showed these in the first slide, but I just left them because I wanted you to show you this. This was the old school IUD. Kind of it's shaped like that. I don't know who thought of that. But you know what I'm saying? It is all over the place compared to the one that, you know what I'm saying? So when they put it, they have this little string. I wonder whether maybe the string just comes out of the cells a little bit, you know, through the cells, so that when you want to pull it out, then they just open up the vagina with this cannula thing, and then they get it to the string. Anyway, that's the old school IUD. And this one, you can look at it later. It shows you how effective all these methods are. So it shows you the number of pregnancies, if depending on which you're using. You know what I'm saying? And you can look at this. But what I want you to know for this lecture is just pretty much the birth control method, how it works, and you know. So the birth control method will be a description of it, like say an intramuscular injection of epoprofen. That will be the injectable contraceptive, and then it disrupts, you know, the secondary oocyte formation, and it will cause the fetus to become also an embryo. That's how it works. And then disadvantages for methods of application. For each of those methods, I want you to be able to tell me all those things. All right, and also know the definition of birth control, the two contraceptive methods. Okay, prevention of fertilization, and also prevention of system pregnancy. Okay, guys? Thank you so much. I appreciate it. This is the end of it, and we'll do the review on Monday. I appreciate it.